to, say, well, the hospitals should have fought back when, the potential ramifications of not complying with the conditions of participation are exclusion from the program. And so that's
Did anyone challenge that? That's really my question. Anyone challenge that to see if that was really going to be what happened? And I would submit to you that it didn't. I'm interested in protecting our healthcare workers, which I'm guessing you are too.
Sure.
And so I just wondered if you had any thoughts on the fact that I feel like we threw them under the bus. And I just wondered how your association felt about that.
I think, Representative, if you ask the hospital executives across the state, just like I'm sure that if you polled in this room, you would probably get different opinions on how people felt about, vaccines and the mandates. I think our industry has always felt like that those decisions really should be, made at the hospital level and independently, what's going on in your community.
Well, I can tell you what was going on in my community. In the beginning of COVID, I had a tremendous amount of calls to ask for exemptions from nursing students, from nurses, from, I don't know that I had a lot of doctors, but therapists, all kinds of people that were at risk. And some did, many did, lose their jobs because they could not conduct their positions because they would not take the shot, and no one was appreciating the fact that they could be exempt for philosophical reasons and other reasons. And so that's just a real concern. I'm sorry to be, I feel like I'm getting a little bit emotional, but it's because I have so many people that relied on us to do what we could to help them, and I feel like we failed in a lot of instances. And I just wanted us to at least get that on the record and for us to start thinking about that.
Sure.
The other thing I would like to follow up on what my colleague Representative Edmonston said about pushing back. She was asking, did anybody push back on this? And the truth is, the person that should have pushed back on this was the previous leadership in the state. Okay, if this were going on now, Jeff Landry would push back with both hands, and so would Liz Murrell, and so would Ralph Abraham. But our citizens were left twisting in the wind because the government would not push back and would not say our people need to be treated better. I mean, that's my estimation for who should have pushed back. Yeah, I think y'all should have too. I mean, I think your physicians probably should have pushed back. But this is the state of Louisiana, and we license these facilities, and our governor and his team should have been the ones that were pushing back.